made this video. This is video from the Smosys YouTube channel. I take some data from that video. Hope you like the video and enjoy it. So coronavirus is also called Covid-19 because COVID, COB for coronavirus and BI for viral disease and 19 for 2019. It was outbreak on December 2019 in the Yuan city of the China. So let's talk about the morphology of the coronavirus. It is unsegmented single-stranded RNA enveloped virus. There is a presence of spikes on the surface. They are called halo or crown, so it's called corona. Its name comes from that. And the major outbreak of the coronavirus disease are the SARS, MERS, and COVID-19. The SARS was outbreak on 2002. It was called severe acute respiratory syndrome, and the SARS was seen in China, and MERS in 2012 Middle East respiratory syndrome was seen in the Saudi Arabia, outbreak on Saudi Arabia, and this latest one SARS COVID-19, it was outbreak of the China Yuan city. So let's talk about the reservoir of the virus. First, about the SARS. It is said that it came from the bat to the cabinets and finally to the human beings. And for MERS 2012, it was from bat to the camel to the human beings. But study shows for the COVID-19, bat, then to the pangolin and to the human being, because 96% of the strains of the virus in the pangolin matches with the virus in the human beings. So let's talk about the symptoms. Before talking about the symptoms, we have to look for the incubation period. The incubation period may vary from the 5 days to the 24 days. So a person can be asymptomatic during this period and spread the disease to the others. The major diagnosis for the COVID-19 is reverse transcriptase PCR, and also we can do X-ray and CT scan. The CT scan has its typical finding like ground glass opacities, consolidations, crazy paving patterns, and typical absence. There is no absence of the pleural effusions, lymph node enlargement, and the lungs cavities in case of the COVID-19. Let's talk about the symptoms. After the incubation periods, the symptoms of fever, high grade fever, usually more than 102 degrees Fahrenheit, cough, dry cough, shortness of breath or dyspnea or chest tightening, which eventually may lead to the pneumonia, acute respiratory distress syndrome and shock, and finally to the death. It is more prone to the immunocompromised patients who have the less immunity to fight with the disease, like diabetic mellitus, hypertension, coronary artery diseases, and elderly patients. So the iris area of the body is called T-zone. It is on the face, including 2 eyes, nose and mouth. It's almost like alphabet T, so it's called T-zones. So doctor advise patient or all the people not to touch the T-zone of the body. So the treatment is supportive care, and till date the medications are not been specific treatment has not been made. So supportive care and is the only measures. Preventions can be done by the hand washings using WHO protocols almost for 20 to 25 seconds. Avoid travel to the outbreak areas and crowded areas. Don't touch the T zones of your face. If you are healthcare workers, then you should must wear the personal protective equipments (PPE). Health persons, healthy person. If you are healthy, then you in the non-outbreak area, you should have to avoid the travel. You should stay away from the crowded peoples. You should stay almost 2 meter far or 6 feet far from the infected persons, and you should use clean sterilized surface. You should do carefully and washing as per the WHO protocols. Don't touch the T-zones of the face, and you may be far away from the virus. Stay safe from the coronavirus. Stay healthy. Don't move out of the home. Stay in home. Spend the quality time with your family. Thank you.